tester. I think ngwanaka last monaka ona le 7 years. Ne. Ke no tester na ko ke qeta go tswalla. So no, I get to be status saka ke jwa. Ha ke ba ke bua maka.
The person that infected me was the first person I ever had sex with. So we don't really get into it that deep about who have you been with, when last did you get an HIV test, how many sexual partners have you had in the past. We honestly retest about okay, no, he looks okay, so probably he's not sick or anything like that, to be quite honest.
What is the significance of World AIDS Day? How many people are not aware of their HIV status, and can you live a long and healthy life with HIV? Hello and welcome. I'm your host, Dr. Musamto Mene. Signing with us today is Trifosa Nzoelengwe. On Vital Signs, we focus on HIV. December 1st marks World AIDS Day, a day created to raise awareness about HIV and the resulting AIDS pandemic. The theme for World AIDS Day 2021 is End Inequalities, End AIDS, and End Pandemics, with a special focus on reaching people who are left behind. Coming up on the program, we speak to one of our SABC reporters at the World AIDS Day event commemoration happening in Limpopo. We listened to inserts produced by Wandile Mufokeng. He spoke to a YouTuber who is quite popular and is an author, and she shares her life journey with HIV. And we also spoke to two women who share their views with regards to HIV. We'll speak to the director of HIV prevention strategies at the National Department of Health about the progress made to fight HIV and AIDS in South Africa, as well as the national chairperson of the Treatment Action Campaign about the failures of the healthcare system in South Africa. We'll also speak to medical advisor and professional nurse at Shouted Now about their programs designed to educate and empower communities to make informed decisions. You can be part of the show by asking the guests that we have on the show some of the questions that you have on your mind. Simply share your views with us on everything we're discussing today. The number to call is 011-714-5861 or 011-714-5877. You can also share your thoughts with us on anything that is happening on social media, of course, and that is using our Twitter. The Twitter is at SABC Vital Signs, and on Facebook it's SABC Vital Signs. Vital Signs continues right after this ad break. Stay with us. Welcome back. This is Vital Signs. Deputy President David Mabuza, in his capacity as the chairperson for the South African National AIDS Council, SANEC, will lead the official commemoration of World AIDS Day at Saselemane Stadium in the Limpopo province. The national theme for this year's commemoration is working together to end inequalities, AIDS, TB, and COVID-19. Get tested, get vaccinated, and adhere to treatment. Here to give us a view of the event, we're now joined by SABC reporter Lutendo Bubodi. Good day, Lutendo.
Thank you so much. As you can see, we are here at Saselemane Shukundu. This is one of the most beautiful places in Limpopo. I'm not trying to be a tour guide here, but this is where this event is being hosted today here. As we said earlier, we are still awaiting the Deputy President Mabuza, who will be coming through now, but we hear that he's still busy, of course, doing some door-to-door, some sort of a door-to-door program where he's visiting families, drumming up the message of COVID-19 and also the message of TB and HIV/AIDS. He's expected to be here soon, but because of some delays, the program is expected to be starting around 12 o'clock midday. But as we are waiting, you can see queues and queues of people, of course, coming through and people trickling in. And here, as you can see, people here testing for their vitals. Your BP, of course, your cholesterol, sugar level. This is important, and especially with elderly people, the senior citizen getting their own. Also, I heard that there's also a point where people are getting vaccinated. We are also, as media, drumming up that message that people should be vaccinated, looking at the spread now of this COVID-19, the numbers going haywire, astronomical figures in the last few days. And yes, As we said, the program here will start at around 12 o'clock. There have been some delays. As I'm speaking to you now, police are busy with bomb sweep. That should have been done earlier. We were told that around 6 o'clock that process will be done. But now there have been some delays. They're right now doing that bomb sweep. That is why we are here outside the stadium where this event will be happening.
All right, Lutendo, I mean, the community seems to be out in their numbers. And the big thing with things such as this, especially big events with all the numbers that you're highlighting, I think it's a very important day to go out. So is the community taking up all the services that are being offered at this event to commemorate World AIDS Day, such as the HIV testing, the COVID vaccines? Are you seeing that on the ground?
Yeah, of course. As you can see, let me just pan it to my right. As you can see here, people young and old coming in. They understand. They know what the deal is. They understand what is happening here. They understand that they need to get tested. They understand that they need to get vaccinated. They understand that they need to get tested for their vitals. And they are here. They are here wanting to hear the message. They can't wait to hear the message from the Deputy President about HIV, about TB, especially now that we're in the midst of a pandemic where this program, this HIV/AIDS program has been disrupted, with people not wanting, not keen on going to health facilities to receive their medication, you know, with people not allowing or welcoming people into their homes in fear of the COVID-19.
Okay, to wrap things up, I just need to find out which other speakers are speaking today. I know you've mentioned the Deputy President, but who else will be speaking today?
Yeah, you have South African National AIDS Council. That's vital. That's pivotal. You need a message from them. Who spoke to them earlier, and they were not really happy, particularly happy with certain things in terms of the government program in dealing with HIV. And we're going to talk to that a little later. Of course, there's also the MEC for Health in the province who will also be here. Talk about the challenges in the province. As we said earlier, you've seen what the challenges are, especially when it comes to undocumented foreign nationals that are here in the province.
All right, thank you so much, Lieutenant, for joining us today and giving us an update on the event happening currently in Limpopo. And of course, that is to commemorate World AIDS Day as we celebrate and commemorate that today. Moving on with the show, popular YouTuber and author Nozibele Mayaba was diagnosed with HIV in 2013 after she met her first boyfriend at the time. 6 years after she was diagnosed, she finally found the courage to publicly disclose her HIV status and use her own story to inspire, engage, and educate others on issues related to HIV as well as health. She sat down with producer Wandile Mufokeng to share her life journey with HIV.
The person that infected me was the first person I ever had sex with. And that's how, you know, this all came about. But before my diagnosis, you know, it's not a matter of, oh, I can't remember who I had sex with or I didn't use a condom with. It just happened with that person. I was naive. For me, I fell in love, and because I knew that I was safe, I wasn't sleeping around, I had not slept around, I thought now this person also was safe. And because of that, I was like, oh, I don't see any reason to use a condom because, you know, the only thing I need to worry about is getting pregnant because I can't get pregnant before marriage, you know. Other than that, HIV is the last thing on my mind.
She thought she had found her Prince Charming, the man whom she was going to spend the rest of her life with. Little did she know that he would change her life forever. Author and activist Nozibele Mayaba invited us to her home to share with us her journey with HIV. She tells us how it has impacted her life.
But it was particularly hard because I knew that I was not okay emotionally. Physically, I was fine because there was not a matter of your CD4 count is very low or your viral load, you know, if there's something wrong, you need to start treatment. I was physically fine. I remember my CD4 count was over 600 and my doctor was very happy that I didn't even need to start treatment immediately back then. But it was more emotionally and psychologically that I was just not okay.
Nozi was diagnosed in 2013. and at that time, she was instructed not to start her treatment as she was considered relatively healthy. She explains why.
At that time, the regulation was only people that had a CD4 count of less than 350 were encouraged to start treatment. I had a CD4 count of about 600, right? So I was considered relatively healthy. There was nothing to worry about. And then around about 2015, 2016, that's when now the World Health Organization said, everyone, regardless of your CD4 count, you test and you treat, right? So if you're tested positive, you study treatment immediately, regardless of your CD4 count. Then I only started treatment beginning of 2017.
Nozibele met her husband 3 years later after being diagnosed with HIV. They have been taking precautionary measures to make sure they live a healthy life.
By virtue of being on ARVs, it assists the virus in my system to be undetectable, meaning that the chances of me infecting him are very slim to none, and that obviously assists us in our journey, in intercourse or us having a baby in the future. And then, as an extra precaution, he's also on PrEP, pre-exposure prophylaxis, that is taken by people that are at high risk, considered a high risk of being infected, such as sex workers. But generally, it is very much encouraged to anyone, that is HIV negative, to take a PrEP to assist them in not getting, HIV.
Nozibele is a self-published author and has written a children's storybook inspired by her 4-year-old niece titled I Am Still Zuri. In the book, she is trying to destigmatize how HIV is viewed.
So this is I Am Still Zuri by Nozibele Kamganamayabe. It's based on a 7-year-old girl that was born with HIV. And the whole purpose around the book was, we recently took my brother's daughter, right? She stays with us, she's 4. And I was minding my own business and taking my ARVs, usually at night at 9 p.m. And when she asked me if I'm sick, and I couldn't answer that because she has come to know that when she's sick, we give her medication. So now that I'm taking a pill, am I sick? So how do I tell a 4-year-old that I'm sick, but I'm not sick? Do you get what I mean? It triggered a conversation with him to say, oh gosh, how many actually parents go through the same thing where if they're taking ARVs or the child themselves is infected with HIV, having to explain what HIV is in a manner that does not instill fear, because that's what HIV is in some community.
As an HIV activist, Nozibele says she will continue to advocate for those living with HIV, and she feels more resources are needed to fight HIV and AIDS.
In our HIV space, we continue to say we will never stop, our advocacy work until there are 0 infections. So at a time where there are no infections, no one is getting infected, then that's when we say, okay, we've done our job. But up until then, we continue to do our work. So I think the one tool that we can overcome stigma is to continue having these conversations. I think particularly also with COVID, all our attention has gone to COVID. How do we protect ourselves from COVID and all of that? All our resources have also been, invested in COVID and finding and making sure that we are protected. We've kind of also been sidelining other, infections or other diseases such as HIV.
Each year on the 1st of December, the world commemorates World AIDS Day, with people around the world coming together and uniting to support people living with HIV and remembering those that have died from AIDS-related illnesses. The World AIDS Day commemoration will be the second event to occur since the advent of the COVID-19 pandemic in March 2020. And of course, with this day and being such an important day, there are many events happening in and around the country. Many corporate facilities, many public facilities will be hosting these events, going out and encouraging encouraging people within South Africa to know their status as one of the big hallmarks of trying to tackle the HIV and AIDS pandemic that we find ourselves in. Of course, there are many role players and many people across the world that act as activists, but also people that are on the ground with respect to them being healthcare workers as well as activists that are going out to spread the message that highlights the importance of going out and making sure that you know your status, because information in your hand at this point, of course, goes out and informs and makes a better decision for the person that has that information in their hands. So it's an important thing to go out and make sure that you get your HIV test done today. There are many facilities in which you can go out and do it, with many tests being available, whether you're doing a blood test, whether you're going out and doing a finger prick test, where they test and make sure, you know, they're able to see if you have HIV or not. There are many ways that we can go about it as well. So it's an important thing to go out and do today, but not just today, any other day after this. Now, South Africa, of course, has got this program and will be going out to make sure that we test as many people as we can to inform them. Joining us now is Dr. Thato Chadarikiere, who is the Director of HIV Prevention Strategies from the National Department of Health. Good day, Doc. How are you? Good day, Doc. Dr. Thato? Okay, I think we're having connection issues at this point with Dr. Thato, but basically the discussion we're trying to have with Dr. Thato is really highlighting the importance of this day, but not just that, all the things that the National Department of Health is doing with respect to reaching the targets that they want to reach. Now, in the past, we had the 90-90-90, now we're looking at the UNA's 95-95-95 targets, and we really want to find out whether we can reach these targets. Are these targets that are achievable? You know, will we get to a point where we know that if you're undetectable, you can't transmit the disease and things such as that? Very important discussion that we're having. We're going to try our best to bring it back on the line so that we can address those issues. Of course, there are more things, and of course, there are other things that we can discuss today. And the only way to know for sure if you have HIV is to go out and get tested. You can't rely on symptoms only, just the symptoms by themselves, to tell you whether or not you have HIV. Knowing your HIV status gives you power and gives you powerful information that you can take the right steps to keep yourself and your partner healthy. What happens if you don't know your HIV status and you're engaging in sexual activities with different partners? Why do some people, you know, not use contraceptives? You know, condoms are there. There are ways that you can make sure that you take the medication should you think maybe you were exposed, and you can get that sort of treatment. Well, we went out and spoke to two women who shared their views with regards to HIV. Let's take a listen.
I doubt there's someone who is around my age who isn't sexually active. Yeah, I am.
And then within your sexual behavior or activity, do you use e-protection? Are you with one partner also?
Not necessarily. I'm not necessarily with one partner, but I do make sure that every time I do engage in any sexual activity, I do use protection.
Kiachita. Yeah, kiachita.
And then, Mom Chito, how do you use? Are you sexually active? Like you are engaged, and do you use protection?
I don't use protection no more. I can use. Yeah.
And then your reason for not using protection?
Because one rat. Ntato ke phela nena ka muntu. Ha nkeletse next. Motho a nkeletsa nkena o. So sometimes they can use a pili protection then. Some no high. And over nyala. Yeah.
And then how do you choose your partners? Or do you even screen them? Do you ask them about their statuses when you engage in sexual activities?
To be honest, no. We don't really ask. I think we don't really get into it that deep about who have you been with, when last did you get an HIV test, how many sexual partners have you had in the past. We honestly test about okay, no, he looks okay, so probably he's not sick or anything like that, to be quite honest. We don't really go into detail.
No test no pregnant. No, I get status.
But are you not afraid whilst we engage
that is why on a general test.
No, I am afraid. I am afraid, but I don't know. We think a condom is safe. If the condom is on, then you know that you are safe, but you can never be 100% safe, because should anything happen and the condom breaks or anything like that, that means that I am putting my health at risk to contract anything from the next person. But we do it anyway, to be quite honest.
But let's say, you are with this new partner and they refuse to use protection. How do you navigate around that issue? Or you need to use protection?
Then we're not going to engage in any sexual activities if that's the case, because as I did say, I don't have one specific sex partner. So the reason why I use a condom is because I know so if the person refuses to use a condom, then that means that we're not going to do anything.
Interesting discussions, and I think those views are interesting because these are real world views. These are people that live in and around us that we might have the same views with them. It's quite interesting. Right, like I mentioned, on the 1st of December we always commemorate World AIDS Day, and before we went to the package insert where you saw the ladies speaking about their thoughts, we were having a discussion. We're going to have a discussion with Dr. Tato. I guess she's back now. Good day, Dr. Tato.
Me?
Good, Dr. Tato.
Yes, I'm with you.
All
Can
right,
you hear
great.
me?
So I think let's jump straight into it. Let's talk about what the National Department of Health is looking at. What is the current status of HIV and the battle that we currently have against HIV in the country?
So when you look at the overall battle, I think, let me use the word that you're using. If you look at the overall battle, our infections are on a downward trajectory overall. However, we see pockets of fight, especially in young people. When you look at adolescent girls and young women between 15 and 24, we're seeing some spikes there that we are not really comfortable with as a department, because we don't want our young people to be infected. And it's not just with the HIV there, it's also unplanned pregnancies, as we all know, and that's what we are also trying to fight. That's why we're trying to say, as the theme for the World AIDS Day this year, that we should end inequalities and ensure that we together fight AIDS, TB, as well as COVID-19.
Okay, so let's look at HIV and AIDS in South Africa. I mean, what is still required for us to reach that UNAIDS 95 target in South Africa?
Right. So if we're looking at where we are now, you would remember that between 2016 and 2020, the world, including South Africa, was moving towards the 90. So as we speak today, South Africa is sitting at 93, 72, and 89. So that's where we are in terms of 1990, which means that we have surpassed the first 90 in terms of testing as a country. However, if we go deeper into granularization, we see that, in terms of young people, again, they have not yet reached their first 90. And when you look at men, the second 90 is still much lower at around 65%. And then females are a little bit much higher. So what we need now is to continue to ensure that we keep testing those who may be HIV positive. We work harder in trying to put everyone who is HIV positive on treatment. And this means that even those who tested positive before, because remember we had different policies in the few years that one needed to actually have a certain number of CD4 count to go on treatment. However, now we test and we treat. So we really urge those who were HIV positive and did not go on treatment to come back so that they can get onto treatment. And that's what we call a Welcome Back campaign. And then, of course, if we have the number that we need on treatment, we just need to make sure that we keep them virally suppressed by ensuring that we reduce the pill burden, which we're already doing by the 1 fixed-dose combination that we gave, and also to ensure that the patients that are stable get the treatment in pickup points. So we're trying to make it a lot easier to reduce the burden in terms of taking treatment so that our clients and patients stay on treatment.
Now, let's talk around the U equals U, so undetectable equals untransmittable. How effective is this U equal U goal in South Africa that we currently have?
Right. If we can really just get to that 90, our second 90 and our last 90, on a population level, we are able to manage transmission or reduce transmission by ensuring that those who are HIV positive stay on treatment and remain virally suppressed. Viral suppression meaning that we keep the viral load at undetectable level. What this means is that if the viral load is undetectable, the chances of transmission are very, very limited. So that is why we get to untransmissible and undetected, meaning that if you remain undetected on a population level, we can manage the risk of transmission, which will actually manage acquisition, which means that if we manage the epidemic in terms of people that are positive, we'll be able to manage acquisition, which is new infections.
Now, we speak about HIV vulnerable groups, and a lot of the time the discussion will always live around young women and girls aged between 15 and 24, and of course the infections in this group seem to be quite high. Why are we finding these numbers being so high, and what are we doing to reduce these numbers?
So let me start with what we're doing to prevent. The National Department of Health actually has two main preventative interventions for HIV acquisition. So here we're talking about condoms, male and female condoms. You'll know that we have our Max and Maxima condoms that come in different colors and scents. And we know that condoms remains the cornerstone for prevention of not just HIV, but also unintended pregnancy as well as STIs, which is really what we see as a triple burden for young people. But what we're trying to do now to ensure that our young people, especially young women and girls, are not infected, is to try and ensure that we strengthen our outreach activities. We roll out also pre-exposure prophylaxis, which is one pill combination, ARV, that is actually taken by those who are HIV negative and at extensive risk or substantial risk to ensure that they remain HIV negative. And then the one thing that we also really encourage and continue to promote is condom use, because, as I said again, the triple action of condoms, of being a contraceptive in itself and also preventing STIs, really works. So those who have been under unintended exposure, here I'm talking about maybe a condom has burst or an accident where one gets into contact with infected blood, or even occupational or sexual assault, we have what you call post-exposure prophylaxis, which is PEP. And PEP is the one pill that one takes within 72 hours of the unintended exposure, and they take it for 1 hour. It is supposed to actually prevent acquisition of HIV. And then, of course, treatment as prevention. Those who are already HIV positive, they take treatment. We fall over to the U=U.
Great. All right. We continue our discussion with Dr. Thato, who is basically giving us an outline of what the Department of Health is doing with regards to highlighting the importance of testing as well as discussions around HIV. We're going for a quick ad break. Do not move a muscle. See you when we come back. Welcome back. This is Vital Signs. We continue our discussion with Dr. Thato, who is the Director of HIV Prevention Strategies at the National Department of Health. Back to it, Dr. Thato, and I really want to just look at this idea of HIV prevention. I think, you know, when we think HIV prevention, we always think about mother-to-child transmission and how this is a big thing that the department always goes out to chase. So I think let's chat around that. What are the strides that the department has made to ensure that we're at a low number in all respects? Dr. Thato?
So yes, I'm with you. Can you hear me?
Yes, I can.
So we have different strategies for preventing transmission of HIV. And as we may know, also HIV can be transmitted mainly through unprotected sex, but also through mother-to-child, as you have already mentioned, but also through certain unintended exposures, which could include occupational exposure, which could include condom bursting, which will be now reverting to unprotected sex, but also accidental exposure with blood, including people who inject drugs and use the same needle. So our prevention interventions here include from mother to child ARVs to ensure that pregnant mothers test for HIV and they are put on ARVs to prevent transmission to the child. And then we also, as I've said, for unprotected sex, condoms play a critical role, but also PrEP, pre-exposure prophylaxis, and unintended exposure, we have PEP. So we're really working on ensuring that we don't only promote biomedical interventions, but we also promote social and behavior interactions, the counseling and support, as well as structural interventions, where maybe one of the things we do is to take services to the people. We do outreach activities, we go to tertiary institutions, we go to malls, to farms, to ensure that we get the people that are usually unlikely to go to a facility for different reasons.
Now, HIV and TB co-infection go hand in hand. I mean, we've heard of this for many years now. How are we doing with making headway with regards to the scourge?
So with TB, we have intensified case finding to ensure that when one comes to a clinic, they are actually, you can, let me say, treated, for lack of a better word, as an index client, and then we try to follow up on the contacts at home to ensure that everybody who has been in direct close contact with a TB client actually also gets screened. So in public health facilities also, our policies state that anyone who comes in to test for HIV should be screened for TB. At least we know that with TB we have symptomatic signs that we can look at and screen for clients. That doesn't even have to be done by a nurse or a clinician. It can just be done by any person, even a lay person in the clinic, symptomatic screening. And then if one has any of the signs, then they are referred to a nurse for diagnosis. And then we put people on treatment. And with TB, at least we know that TB is curable. If one takes that treatment early enough and they take it to the full, all of it, and adhere, TB can be cured. So that's a very important message when it comes to TB. However, with HIV, one can manage also infections of opportunistic infections like TB by taking that treatment and ensuring that their immune system is strong. Thank you.
So let's talk about HIV and men. I think it's a big and important one to have because of what you've highlighted today. But is there success and are there challenges that you're currently facing with engaging men and getting them to take charge of their health?
You see, men in general have actually been a little bit challenging in terms of trying to get them to seek help. So there is a generally poor health-seeking behavior when it comes to men in general. But, you know, because of sometimes circumstance and, again, the social factors that I talked to, you may find that also even the working environment, if people are in close proximity and then they don't treat their symptoms, they could actually infect each other. So really it's important that at least at some point one should actually go to a facility just to check symptomatically or to actually check within themselves if they are not feeling well, to ensure that they go to a clinic, and when they do have a chance to go, they should actually just do an overall screening of all these opportunistic infections, communicable diseases such as TB, HIV, STI, so that they can go on treatment.
Now, there are big strides that we've come across and we've heard of over the past years with regards to research and, importantly, treatment. In terms of a National Department of Health perspective, are we and can we get access to these vaccines, maybe even these treatments that you can take that, you know, take away that daily pill taking, such as an injection that you take over some time? Are we getting closer and closer to that point?
Research is very important at this point. As we know, research actually informs policy. And in terms of, for example, prevention interventions, PrEP, or pre-exposure prophylaxis-based interventions, we know that scientists are still working on a long-term active PrEP intervention, which is called cabotegravir, long-acting antiretroviral, CAP-LA. And once our research has given us the results that show us that this can be done and it works and it can be used, then we will be able to just take it through our regulatory bodies like SAPRA, WHO, and then we will be able to give it out. So we are working towards long-term acting interventions because they reduce the burden of pill, which is what we talked about earlier. And once those are done and we got research, then we'll be able to work on regulation, and then we give them out as well.
Thank you so much, Doctor, for joining us today and really discussing all these strategies that exist and are available and all the steps that the National Department of Health is taking to get us to a point where we reach those goals and we really find ourselves at a U equals U, where if you find yourself that, you have HIV, that your viral load is undetectable so that you can't transmit. We're going for a quick ad break. We'll see you when we come back. Welcome back. This is Vital Signs. I'm Dr. Musam Tombeni. South Africa has both the world's largest HIV epidemic and largest HIV antiretroviral treatment program. There are currently 5.5 million people living with HIV on ARV treatment. Now, according to TAC, 2.3 million people are still in need of treatment, and the country is currently off track with terms to meeting the UN AIDS 90-90-90 target. Amongst other challenges, the rate of HIV infection is far too high, and about 1 in 3 people who start treatment are lost in the system. This is a reality that is being fueled by multiple systemic failures in the healthcare system. Join us in talking to the failures, of course, within the healthcare system. We're joined by Msibongile Shabalala, the National Chairperson of the Treatment Action Campaign. Good morning, Ma. Hello, Msibongile. Msibongile, can you hear us?
Yes,
Uyasizwa, Ma? All right, I'll just wait for her connection to get a little bit better on. But if you don't know what the Treatment Action Campaign does, they basically are advocates for people and, of course, people that need to access health services that are provided by the state. Now, the big thing and the, big things that they've done in the past, of course, live in and around getting treatment and helping and assisting people that have HIV and, of course, identifying the failures that have come about from all the different things that have happened over the years with regards to the ARV treatment and the challenges that have come from there, from having challenges such as provincial health systems that aren't functional, where you find yourself having people that have cancers and things such as that not necessarily getting the treatment that they would and should be getting, and all those failures are identified for them. So basically, they're advocates for the people with regards to health challenges. I hope Msibongile is back and we'll continue our discussion so she can highlight some of the challenges that are currently being faced by people who have HIV. Msibongile? Let's start off by jumping into it. Ama challenges are faced that are being faced by people with HIV in this country. What are the big ones that you've identified?
Ama challenges that are faced by people living with HIV mostly in this country is often stock out that we are experiencing on the ground, and the bad attitude from healthcare workers, and also the facilities that are closed due to COVID recently, and the infrastructure that is not up to standard to accommodate everyone, not only people living with HIV, but everyone who seeks healthcare services in South Africa.
So the big and important thing here, and I think you've slowly kind of highlighted it, is this idea of access to treatment and the attitudes that people have towards people that are coming in to collect their HIV treatment. Is this a big issue that you've identified, and what are some of the problems that the people that come to you and lay these complaints for you guys to take on and go to these departments and address? Do we find ourselves in a position where, we are able to identify what these big issues are and then come up with solutions for them, Ma?
Yes, we are continuing to do the community monitoring and treatment action campaign so that we see how people are accessing services. Actually, we are working as people living with HIV sector, where we have all the organizations that are working on people living with HIV. So in our findings, what we see mostly is that key population are most affected, and young people, because as much as we have young people who are infected with HIV and have numbers, but the question is, are we catering for those young people? Remember, we don't have much of youth-friendly services in facilities, which keeps more young people out of the facility, and mostly key population. When I'm talking about key populations, I'm talking about people who are using drugs, people who are sex workers, LGBTI community, which are not yet accommodated fully in our facilities, especially in terms of accessing ARV treatment.
So the important thing, and I think one we can't run away from, is the effect of COVID. Did you find that COVID, when it was around or still is around, that people are having issues with accessing their medication and accessing treatment?
We have experienced that a lot on the hard lockdown that we were in last year, where facilities were closed due to healthcare workers being infected with COVID, and patients were left stranded without communication to say where can they fetch their medication. And remember, in South Africa, we are having only few cities where people always relocate for work. And people, when the lockdown was announced, people decided to go to their families thinking that it will go only 2 weeks, only to know that it was 5 months. During that time, many patients were not able to access treatment because they were not in the areas where they are taking their treatment. And we had to do a lot of advocacy for facilities to make sure that they give those people treatment. But also we have seen a high number of people who are lost to follow up on treatment, which it was a great concern for us. But we are continuing to work with government to make sure that we bring back those people on the system.
So you work with government quite a lot, but you also, I don't want to use the word fight, but you know, you always have issues that you'd like to address with government as well. Some of the successes that you've had have obviously been big ones, but what are some of the big cases that you're trying to chase now in order to basically make health equitable?
What we are mostly working on now is the issue of infrastructure, which is a big challenge in almost all provinces. When you go to clinics, the conditions of the clinics are not up to a standard where you can say we can access services. Also, the issue of human resource, which is a shortage in almost every province. It's also the problem that we are still discussing with the government. And in actual fact, as much as we are raising these concerns to government and always challenge the government to fix the broken healthcare system, that doesn't mean that we are enemies of government, but we are also working with them towards reaching the same goal of servicing people on the ground.
And that's so important, servicing the people on the ground. Thank you so much, Mam Sibongile Shabalala, the National Chairperson of the Treatment Action Campaign. Very important information outlined there. And most importantly, just making sure that everyone has access to their medication. After the break, we speak to medical advisor and professional nurse at Shout It Now. Stay with us. Shout It Now is a South African organization that specializes in mobile community-based HIV counseling and testing. Shout It Now combines global best practice with tech-driven innovations to advance HIV prevention and treatment in South Africa. They provide an integrated service offered to men as well as women between the ages of 10 and 49, with a particular focus on adolescent girls and young women. The integrated services offering, of course, also includes sexual and reproductive health, HIV, as well as violence prevention programs, and not forgetting lifestyle programs designed to educate and empower communities to make informed, healthy decisions. Joining us, of course, to talk more about Shout It Now, we have Tia Mononela, a medical advisor and professional nurse at Shout It Now. Good morning. Thank you for joining us.
Good morning, and thank you for having me.
So let's start off with, what is Shout It Now?
Okay, Shout It Now is a non-profit organization. I think it's one of the leading organizations that are specializing on HIV prevention. So even though there is a very wide spread of HIV, I think the best part is that HIV is preventable, and then it can also be manageable. So as you've already mentioned, we are specializing in HIV prevention. We're working in Gauteng, and we are also working in the Northwest. So in Gauteng, we are based in Tshwane and in Ekurhuleni, and then in the Northwest, we are in Bujanala, in Dr. KK, and in NMM.
So you've spoken, and I think I've spoken to it too, this use of tech and innovative technologies as well as best practice to make this experience much better. What kind of tech do you use and how are you innovating?
Shout It Now. I think it is also on the lead when it comes to innovation. And the great part is that today we are also launching our Iyako Mugel. So Iyako Mugel is a membership group that is encouraging and rewards and celebrate healthy behavior. So we are offering our services at the buses. We started at the gazebos, but now we are at the buses in different communities around those areas that I've mentioned. So on the buses, I think our clients are experiencing the best experience because when they enter there, we are paperless. So when they enter there, we service them, giving them HIV counseling and testing, our PrEP services, our PEP services, and then our contraceptives, STI screenings, and also GBV. So we capture their information digitally online. And then, as I've mentioned, that today is another big day where we are launching Girl. So Shout It Now is very innovative because one of the benefits of that Girl is a iShout app. So we also have an app that comes as a benefit for these AGYWs, as you have mentioned that we are targeting from age 15 to 24. So that app is composed of all the services that we are offering. So one is able to access information, question and answers, also get rewards for the services that they are receiving from our buses, since we are encouraging and rewarding those healthy behaviors.
So it is World AIDS Day today, and I think it's important to ask, as a healthcare provider yourself, what do you think are some of the big factors that contribute to young girls, especially with you launching an app such as Ayakomogel? What are these factors that contribute to young women finding themselves being HIV positive or contracting the disease?
Yeah, I think it's very much important to understand that HIV is prevented. We can prevent HIV, and those who are already infected, they can manage HIV and still live a healthy lifestyle like everyone else. So our main focus is also pre-exposure prophylaxis. So we are preventing HIV to all the individuals that are not yet HIV positive, but they feel they are exposed and they can get contracted with HIV. So we have pre-exposure prophylaxis. This is one pill that you can take once a day to prevent HIV. So I think all the initiatives are also in support of this program to say those who are testing HIV negative today, we are encouraging them to remain negative, even though they can be exposed to HIV. And those who are testing HIV positive today, we are encouraging them to access ARV services that are also provided through some of our other partners so that they can still live a healthy lifestyle just like everyone else.
An important thing I think we need to highlight is the fact that you guys highlight how important youth-healthy, or rather youth-friendly services are. You know, that young people are able to access all of this. What makes your services so much easier to access?
So our services are much easier to access because we're not based in one place where we can say that young girls, they have to visit us at a certain place, but we are moving around all those communities. So we are easily accessible because all our information are on all social media platforms, and then we do inform our beneficiaries on where we are going to be based at that particular day, where we are going to be providing the services. And this is not a once-off service. So if we are based on a particular area for that period of time, we know that we still have to come back and still continue servicing our clients. So it's not a once-off service. And we also have a Connect Hub, which you can say it's also a call center where we continue to have that relationship and engagement with all our clients that we have serviced on site. So it's a continuous relationship that we have with our clients to ensure that they keep healthy and they continue accessing our services.
Thank you so much for joining us, Tia, and really discussing what Shout It Now is doing, making sure that people are able to access all the health services that they can access without any hassle. It's so important, especially on World AIDS Day, that we look at where we've come from and where we're going, but make sure that we work harder and harder to ensure that we support people living with HIV, but also encourage them to keep taking their treatment. And importantly, make sure that if you are HIV negative, you're able to continue to stay that way, making sure that you take all the medication that you can take in terms of pre-exposure prophylaxis, that you are using contraceptives, and all the things that you heard about today. Thank you so much for joining us. I'm Dr. Mosamtomeni. See you again next week. Thank you.